Good morning, everyone. I will speak in Portuguese, and I would like to introduce, e vou apresentar, então, os membros desta sessão. Quero convidar o senador Eduardo Matarazzo Suplicy.
I would like to invite the members of our panel, Senator Eduardo Matarazzo Suplicy,
que tem uma longa experiência no Senado, tem inúmeros projetos de lei que viraram lei importantes para diminuir a pobreza no Brasil e reduzir a igualdade.
He has a long history in the Federal Senate of Brazil, and he has introduced many bills of law to combat poverty in Brazil.
E é professor de economia da Fundação Getúlio Vargas.
He's also a professor of economics in the Getúlio Vargas Foundation.
Quero convidar também Wyllys de Matos, Santos, que é deputado federal pelo Rio de Janeiro e é membro da Comissão de Direitos Humanos e Minoria e também da Comissão de Educação.
I'd also like to invite Congressman Wyllys from the state of Rio de Janeiro. He is a member of the Human Rights Commission and also of the Education Commission of the Chamber of Deputies in Brazil.
E o mais importante é que ele é coordenador da Frente Parlamentar em Defesa das Pessoas com Doenças Raras.
And most important, he is the coordinator in the Congress of the commission that's dealing with rare diseases.
E quero também convidar o Octávio Nunes, diretor de comunicação institucional da Interfarma do Brasil.
I'd like also to invite Octávio Nunes. He is the communications director of Interfarma, which is the Brazilian research-based pharmaceutical manufacturers association.
Take a seat, please. Vamos sentar. E vamos iniciar rapidamente falando um pouco do Brasil. É o maior país da América do Sul, com cerca de 200 milhões de habitantes.
I'd like just to start by saying that Brazil is the largest country in South America with 200 million people.
E somos, atualmente, em atividade, 400 mil médicos no país.
And currently we have 400,000 MDs in our country.
E a grande maioria, um pouco mais de 70%, situados na região sul e sudeste.
70%, the majority, is located in the southern, southwest region of the country.
Temos, portanto, uma desigualdade de distribuição dos médicos no país.
Thereby, we have an imbalance in the geographic distribution of medical doctors in Brazil.
E calculamos cerca de 15 milhões de pacientes portadores de doenças raras no país.
And we estimate that we have 15 million carriers of rare diseases in our country.
A maioria desses pacientes sequer são conhecidos por falta de acesso ao sistema público de saúde e também devido aos médicos não estarem preparados para o diagnóstico e o tratamento.
The majority of those individuals are not diagnosed correctly because of the lack of access to the public health system, and also because most of our medical doctors are not fully prepared to diagnose those diseases correctly.
E daí a importância de estarmos nesta sessão participando. É uma honra para mim, em nome do Conselho Federal de Medicina.
Thereby, it's such an honor for me to be in this critical panel about these issues because I represent the Federal Council of Medicine.
E começo com uma provocação aos três integrantes com a pergunta básica desta sessão. O que o governo e a indústria estão fazendo para melhorarmos o diagnóstico, o acesso, o tratamento das pessoas portadoras de doenças raras? Vamos começar pelo senador Eduardo Suplicy.
And I start this panel by asking a provocative question to members of the panel. What does industry and government are doing in order to improve the access and the treatment and the diagnosis and the care of all of these individuals that have rare diseases in Brazil? And we're going to start with the Senator.
I am honored to be invited to speak here at this Orphan Drugs Congress, and I would like to thank Roberto Luiz, the President of the Conselho Federal de Medicina, ao deputado Wyllys, que tem se dedicado tanto. So I would like to, I will speak in English, okay? To facilitate the work of our translator. I would like to, I'm honored to be invited by your Congress, and I would like to thank Roberto Luiz, Jean Wyllys, my colleague in the Congress of Brazil, and Octávio Nunes, the Director of Interfarma. So I will try to answer the several questions that you have proposed to us, but I will be speaking more about what we have done, what I was stimulated to present as a Brazilian senator, 3 bills that were proposed after the suggestions of Instituto Baresi, as well as of the Maria Vitória Association, 2 entities that are very much engaged in these issues. So inspired by them, I presented 3 legislative matters on rare disease. The first is the proposal 159 of April 2011 to establish the last day of February, the 29th of February, as the National Day of Rare Diseases. So it is being transmitted in the Senate. It will be object of public hearings. The second proposal, introduced last November 2011, establishes the national policy for the protection of rights of people with rare diseases. So it is being discussed in the several commissions. And the third one, Senate Bill number 231 of August 2011, establishes the National Fund for Research of Rare and Neglected Decisions. This proposal was approved yesterday in the Social Affairs Committee, and now it will go to another committee, the Economic Committee of the Senate. It is interesting to point out that a rare disease is a pathology that seldom occurs in the general population. To be considered rare, each specific disease cannot affect more than a limited number of people in relation to the entire population. In Europe, the definition for rare disease is one that affects 1 out of 2,000 citizens. In the US, rare diseases are those affecting fewer than 200,000 individuals. In Japan, one that affects fewer than 50,000 patients in the country, approximately 1 out of 2,500 people. Well, individually, each of the pathologies seen as rare affects less than 1 out of 2 people, but it must be emphasized there are more than 5,000 rare diseases identified. The etiology of rare disease is diverse. The vast majority of them are of genetic origin, 80%. However, degenerative, autoimmune, infections, and oncological diseases can also originate them. Despite the difficulties caused by rare diseases, many people suffering from them have provided and are still providing great contributions to humanity. President John Fitzgerald Kennedy with Crohn's disease, physician Stephen Hawking with amyotrophic lateral sclerosis, the musician Syl with children lupus, actor Michael Fox, Huntington's disease, the Olympic medalist Doug Herland with imperfecta osteogenesis, and aviator Jessica Cox, who by congenital disease was born without arms. The sequels caused by rare disease are responsible for the rise of near 30% of the deficiencies, which can be physical, hearing, visual, cognitive, behavioral, or multiple, depending on each pathology. The difficulty in medical treatment starts with the lack of a national mapping of these people. The low incidence of rare diseases in Brazil compared to other countries leads to the suspicion that many cases are simply not diagnosed, especially in regions historically not included as the North and Northeast. I can see that you would like me to go by stages, so I will stop here and we'll continue in the second round.
Obrigado, senador. Deputado Jean Wyllys, por favor.
Thank you, Senator and Congressman Luiz.
Bom dia. Peço desculpas, meu inglês não é tão bom a ponto de eu fazer uma conferência nessa língua, então falarei em português, ao contrário do senador Eduardo Suplicy.
Good morning. I apologize. My English is not good, so I will speak in Portuguese for you.
Saúdo os meus colegas aqui, que estão nessa bancada, Octávio Nunes, Roberto Dávila, senador Eduardo Suplicy. E respondendo à pergunta que o Roberto me fez, antes de responder a pergunta, eu quero dizer que o tema das doenças raras, às quais se destinam as drogas órfãs, entrou na minha agenda parlamentar pelo viés dos direitos humanos de minorias.
First, I want to say that before I answer the question that Roberto made, that the agenda of rare diseases came through me, through the other agenda of human rights.
Eu tenho trabalho de enfrentamento do racismo, de garantia dos direitos sexuais e reprodutivos das mulheres e de garantir os direitos da população LGBTQ, a população de lésbicas, gays, bissexuais, travestis e transexuais.
I work trying to uphold the selection rights of women, against racism, and the rights of the LGBT community, all of the different groups under that aegis.
Por conta dessa agenda e porque as pessoas com doenças raras sofrem discriminação, sobretudo as pessoas com doenças raras que incidem sobre a imagem, as associações dos portadores de doenças raras me procuraram para apresentar as suas reivindicações.
So, because many of the rare diseases have manifestations which impact the appearance of individuals and the capacities and so on, and because of that, these individuals suffer discrimination, the different groups that represent different rare diseases approach me to deal with these discrimination issues.
E eu, claro, abri a minha agenda para esse tema das doenças raras.
And I definitely opened my agenda for the issue of rare diseases.
Não só na perspectiva do direito humano à saúde, que está garantido na nossa Constituição Federal, mas também do direito humano a não ser discriminado, a ter uma existência digna, sem sofrer qualquer tipo de preconceito.
Not only is our Constitution guarantees access to health to all individuals in our country, but also it protects the rights of not being discriminated and the rights of no discrimination against any group.
E embora quase sempre, não só pela indústria farmacêutica, mas pelo próprio governo, quer dizer, pelo próprio Ministério da Saúde, as pessoas com doenças raras sejam tratadas como números, por estatísticas, quando eu me dediquei a esse tema, a vida das pessoas, as pessoas concretas na sua individualidade, os seus dramas e os seus problemas se apresentaram.
So even though our ministries deal with a lot of these issues in terms of the large numbers and so on, I have dealt with the agenda from the individual viewpoints, the real hard cases that I have seen that deal with these issues.
É preciso lembrar que se individualmente cada uma das patologias tidas como raras compromete 65 pessoas em cada 100 mil habitantes, é preciso salientar que mais de 5 mil doenças raras são identificadas e que, portanto, esse conjunto de pessoas acometidas, quer dizer, o conjunto de pessoas acometidas por esse total de doenças raras dá um contingente muito grande que não pode ser desprezado nem desconsiderado pelos políticos.
So when I see the difficult problems of the individuals and I start realizing that although maybe only 65 individuals out of 100,000 may have these rare diseases, at the same time I see that there are 5,000 rare diseases. So when I multiply those numbers, I'm dealing with a very large group of people.
Então, só para concluir, nós então formamos uma frente parlamentar em defesa das pessoas com doenças raras.
So what we did then is create a caucus at our Congress to deal with the issue of rare diseases.
E eu apresentei um projeto de lei que regulamenta no Sistema Único de Saúde o tratamento das pessoas com doenças raras que atualmente não existe.
And we're working on a particular language to improve the regulations of the health system to deal with individuals with rare diseases, which at this time they're still not available.
Muito bem, nós vamos falar desses projetos e em que pé eles estão, em que ponto do caminho eles estão para serem aprovados, mas eu quero ouvir o Octávio Nunes a respeito do que a indústria tem feito para a aprovação de uma lei.
Good morning.
Very well. I would
First,
like to give
I would
floor
like to thank
Octávio
the
Nunes.
organization for the great opportunity. It's a pleasure to be here, but I will speak in Portuguese too. Respondendo um pouco a sua pergunta, Dr. Dávila, e falando também sobre as dimensões do Brasil. O Brasil, como disse o Dr. Dávila, tem 200 milhões de habitantes. De fato, é uma nação com dimensões continentais e com um detalhe. É o único país do mundo com 100 milhões de habitantes, com mais de 100 milhões de habitantes, que tem na sua Constituição um direito universal, público e gratuito de saúde. E aí, de fato, desculpa, sorry.
Yeah. First, before answering the question, I will emphasize that Brazil is a very large nation with 200 million people, and in fact, we have continental dimensions. And the unique characteristic that it's the only country with more than 100 million inhabitants that has a right, an enshrined right of universal public free access to health.
Outro detalhe importante é que, em consequência dessa decisão tomada lá atrás na Constituição, é que hoje o sistema não consegue atender toda a população. Pelo menos 140 ou 150 milhões de pessoas dependem exclusivamente do Sistema Único, Sistema Público de Saúde. E os outros 25% tiveram que recorrer ao sistema privado, pagando inclusive do próprio bolso. No caso dos pacientes, das pessoas com doenças raras, provavelmente estão hoje numa situação ainda pior do que a média do cidadão médio brasileiro. Ou seja, muitos não podem serem assistidos pelo sistema público por razões do próprio sistema, por falhas do sistema, e, ao mesmo tempo, a maioria, por não ter condições econômicas, também não podem pagar o sistema privado.
So, at the same time, of course, we have a deficit in the public system that is providing maybe 40 to 50 million people who only use the public system, which does have a lot of deficiencies still. Now, there's 25% of the population who's able to afford private health care, and this has been a situation where it's easy to understand that the people who are taking the public system are in a situation that is worse than the average. At the same time, we have those who are in the public system who probably don't have the option to pay for the private health care. And in the case of rare diseases, they're just not being met.
Eu estou dificultando o teu trabalho, né? Desculpa. Bem, para encerrar esse primeira intervenção, eu gostaria de dizer que, claro, em função principalmente do trabalho dos parlamentares, e também eu acho que a indústria tem uma participação importante nisso.
So I would like to start answering your question that yes, we're following with great interest the parliamentary work that is being done in our Congress in terms of new laws, but industry itself has a responsibility to also work on this problem.
A Interfarma, que representa os laboratórios no Brasil, os laboratórios de pesquisa, publicou recentemente 2 estudos sobre a situação dos pacientes com doenças raras no Brasil e, com base nisso, estabeleceu um diálogo importante com o governo.
A última palavra?
Estabeleceu um diálogo importante com o governo.
Yes, just to give you an example, recently different research laboratories have published 2 reports dealing with rare diseases that have made serious recommendations, and this has provided the basis to dialogue with the parliamentary commissions that are dealing with these issues.
Basicamente, para saber o custo disso para o governo e o custo disso para a sociedade.
And basically is to find out what the cost of this will be for the government and for society.
Ok. Hoje, no Brasil, o acesso a essas drogas órfãs de pacientes portadores de doenças raras se faz através da justiça, através de uma ação judicial, solicitando ao juiz a obrigação do Estado em fornecer o medicamento, já que é um direito, está na Constituição, é um direito de todos e um dever do Estado. Como não é dada, não é oferecida, se vai à justiça obter o remédio. Só as pessoas que têm acesso ao judiciário, nem todos têm, que conseguem o acesso a esses medicamentos por via judicial.
So right now we have a problem of access. A lot of the drugs might be available, but in order to do that, they're not being provided, and they're only being provided because some individuals have been able to sue the government and go to court, and through the judicial action, which is guaranteed by the constitutional right, then it's adjudicated and they obtain the medications. However, not everybody does have access to the court system in Brazil.
Então, no momento, há um trabalho conjunto entre a indústria, os médicos, tanto o Conselho Federal quanto os especialistas da área, e aos parlamentares no sentido de se produzir uma legislação que garanta esse acesso e que capacite os médicos e que se crie centros de referência para esses portadores dessas doenças.
So right now we have a major effort between the industry, between the medical doctors, the Federal Council of Medicine, and the legislators and the specialists, trying to produce legislation that will provide for the training of doctors and the availability of medications and the creation of a reference center for individuals who have these rare diseases.
E a pergunta agora é objetiva no sentido do que está sendo feito, quais os projetos, como estão esses projetos, em que podemos colaborar, tanto a indústria quanto os médicos podem colaborar neste sentido.
Muito bem.
So the question now to them is, what are the projects, what's their status, how many medical doctors are collaborating, what is the industry doing for all of this?
Well, international data show that infant mortality among people with rare disease reaches 30% in the developed countries. This percentage may be even higher in Brazil, since these children do not receive proper treatment. Concrete data would be a basis to develop a coherent approach to the needs of this segment of the population. Recent studies carried out by Eurordis, an organization that assists people with rare disease in the European Union, compared data from 8 rare diseases in 17 European countries in a universe of 6,000 patients and families, showing that 25% of the patients survived, waited 5 to 30 years between the appearance of the initial symptoms and final diagnosis. It is estimated that in Brazil, the difficulty of diagnosis and treatment are even higher due to several factors, including the 1090 gap phenomenon. According to the Global Forum for Health Research, less than 10% of global spending on health research is dedicated to disease and morbid conditions, representing 90% of the global burden of disease. Well, investments in research and development have not really been a great priority for many years, but Brazil, fortunately, is an exception to this rule. It has been already considered a world leader in research on neglected diseases. The initial actions of the Ministry of Health in relation to neglected diseases were launched in 2003 with the first theme announcement of tuberculosis, followed by announcements of dengue in 2004 and leprosy in 2005. In 2006, the Program of Research and Development for Neglected Disease was established and 82 studies were funded with a total investment of $22.3 million. In 2008, 58 projects were funded through joint investments with the Ministry of Science and Technology and administrative support of the National Scientific and Technological Development of $17 million for a total of $39.3 million. In 2012, the Ministry of Health, Alexandre Padilha, announced that the creation of a neglected disease research network with a $20 million fund. And this first semester, Minister Alexandre Padilha said that an open hearing will be organized on rare and neglected diseases.
Eu posso depois dizer os principais pontos dessas diretrizes do tratamento de doenças raras, mas no momento eu quero dizer que essa é uma das funções do Parlamento, quer dizer, propor uma legislação, aprovar uma lei, na verdade, que regulamente esse tratamento, mas uma outra função do Parlamento é a fiscalização sobre o Executivo. E nessa outra função, nós conseguimos que o Ministério da Saúde colocasse em consulta pública uma política de saúde para as pessoas com doenças raras.
So our first action was to create this new bill of law to be approved. And I could go deeper into some of the details of what it contains, but I also want to say that the second important function that we have in our Congress is that of oversight. And through our oversight function, we were able to achieve that the Ministry of Health now has a more detailed reference guidelines internally, and they have been able to go public with it. New policy for rare diseases.
Octávio quer completar o papel da indústria nesse apoio?
Like to complement the industry role.
o deputado comentou nesse momento, a boa notícia é que a consulta pública a que ele se refere saiu hoje, publicado no Diário Oficial da União.
And of course, let me compliment what the Congressman said, that the public audience result was just published today in the main newspaper of the country with all the policy guidelines.
A questão aliás, esse tem sido o esforço da Interfarma, é que justamente se chegue a uma política nacional de doenças raras.
So our main objective for the Interfarma Association is to make sure that the government has a national policy of how to deal with rare diseases.
E que se possa superar barreiras, como, por exemplo, a dificuldade que hoje existe em pesquisa clínica, o registro de medicamentos no Brasil, que demora, e isso para todos os medicamentos, em torno de 2 anos.
And so in order to implement this, we are also working very much in a lot of the details, for example, such as the registry of new drugs, which is a process that takes maybe 2 years at this time in Brazil.
Além disso, a incorporação de medicamentos para o tratamento de doenças raras no sistema público.
And second, then the incorporation and the approval of the use of certain drugs for rare diseases within the operating manuals of the public health system.
E que esta incorporação seja feita com um critério que não o atual, que é o custo e efetividade, por um sistema que possa que tem exemplos no mundo de sucesso, que é o ATS, que é a avaliação de tecnologias em saúde.
And what we want also is that the criteria that is used for incorporating such drugs into the operating manual of the Ministry of Health for the public health system not be done using the standard criteria of cost effectiveness, but to use the criteria of experimental or research-based drug.
Ok. Há uma garantia de acesso prevista nessa proposta de projeto de lei? A questão do preço, reembolso também está garantida? Existe algo nesse sentido, senador?
Are there any guarantees in the Brazilian legislation that will support this process, Senator and Congressman?
Well, not yet that I know, at least. No? Let me proceed a little bit. Orphan drugs are medicine used for the diagnosis, prevention, and treatment of rare disease. For a drug to be considered orphan, epidemiological criteria, low prevalence of incidence of the disease in the given population, and economic criteria, presumption of non-profitability of the drug are used. Both the diagnosis and treatment are hampered by lack of knowledge about this disease and specific treatment protocols. There is also a shortage of specialized professionals capable of understanding the implications of treatments in a body with special features. This leads to the aggravation of symptoms and sequelae. Often, people with rare diseases or associations that gather them are the ones in charge of locating latest studies on their pathology, having them translated and forwarding them to their doctors. People with rare disease face huge social difficulties, often with unsurmountable barriers. Prejudice against some common physical symptoms of these disorders is common, as well as the paternalist view that considers these individuals as a burden to society as opposed to an integral part of it. Many are socially isolated due to the lack of adequate infrastructure to their specific needs in schools, universities, workplace, and recreation centers. The vast majority of people with rare disease do not have access to the necessary conditions to reach their full potential. In this sense, it is very important to emphasize the importance of caregivers, cuidadores, who may be far greater in number when the basic income, the citizen's basic income, is fully instituted in our nation, because people will be able to make a choice of taking care of their loved ones or of any family member who might suffer from problems of this nature. Let me briefly explain what is a citizen's basic income. It is the right of everyone, no matter origin, age, sex, socioeconomic condition, to participate in the wealth of a nation as a citizen's right, equal to everyone, unconditionally. Brazil is the first nation in the world where the National Congress has approved the proposal of a citizen's basic income. But it is said that it will be instituted gradually, step by step, under the executive criteria, taking into account first those most in need, as today we do with the so-called Bolsa Família program that benefits today about 1/4 of the almost 200 million Brazilians, those who do not attain something like, well, 140 reais per month, $70 per month per capita in each family. They have the right to receive a complement of income with conditionalities. But the Citizens Basic Income Law says that one day this will be unconditionally and equal to all. You Americans know that this is a proposal that one of the main ideologues of the American as well as the French Revolution, Thomas Paine, forwarded this proposal in 1795. And if you want to know a little bit more about, perhaps some of you who are of this state, there is just one state in the United States where an equal dividend is paid to all of the inhabitants of this state. Perhaps if there is anyone from Alaska here, he may explain how this happens. And this has made Alaska the most equal of the 50 American states. It's a good proposal. In 1976, when J. Hammond, the governor, proposed to them, 2-1 was the result of the referendum. Today it is considered political suicide for any leader to propose the end of the Alaska Permanent Fund dividend system. So we now have a law that one day we will have this briefly. It depends on John Wyllys telling the president, it's a good proposal, it's time to start.
Obrigado, senador. Deputado.
Bom, esse projeto de lei que eu propus, o 2669, ele se encontra no momento na Comissão de Seguridade Social e Família.
Well, let me go back to the bill that I presented in the Chamber of Deputies, number 2669, which is currently being considered by the Commission on Social Security and Families.
E as principais diretrizes que esse projeto estabelece no tratamento das pessoas com doenças raras são, eu vou ler porque para a gente ficar nos termos certos.
And the main guidelines that bill presents in terms of the treatment of rare diseases, I'm going to read them to you.
A primeira é a assistência médica de reabilitação e farmacêutica plena aos portadores de doenças raras.
The first one is full medical assistance and provision of medications to rare disease patients.
diagnóstico, mapeamento e promoção da efetividade do tratamento das doenças.
Diagnosis, mapping, and promotion of the treatment methods for the particular rare disease.
Fornecimento e promoção do uso responsável e racional de medicamentos, inclusive drogas órfãs, e de dispensação excepcional, além de suprimentos e alimentos específicos quando necessários. Desculpe, vamos lá.
I'll need a repetition. Pode repetir?
Posso. Fornecimento e promoção do uso responsável e racional de medicamentos, inclusive drogas órfãs, além de suprimentos e alimentos específicos quando necessários.
Supply and provision and promotion of the use of rational orphan drug treatments, plus the use of appropriate supplements for the patient.
Avaliação, acompanhamento e, quando for o caso, administração de medicamentos, incluindo drogas órfãs, suprimentos e alimentos nos pacientes.
Evaluation and follow-up on the use of these orphan drugs in the treatment of rare diseases.
Há outras diretrizes, que eu não vou ler porque são muitas, mas a gente tem tido o cuidado de pensar não só o tratamento, a assistência no Sistema Único de Saúde ao portador, à pessoa com doença rara. Estamos preocupados com isso, claro, mas estamos preocupados também com o impacto da doença rara na família.
So at the same time, I'm not going to read all the other guidelines which are contained, but let me say that we are looking at the whole individual and the relationships and the impact it has on the individual and the family surrounding him or her.
Então, além do projeto do senador Eduardo Suplicy de renda mínima, que pode beneficiar as famílias que sofrem com doenças raras, além desse projeto dele, eu tenho um outro projeto que regulamenta a profissão de cuidador, que é a pessoa que vai se dedicar a tratar da pessoa, do paciente com doença rara, e as doenças raras, a gente sabe, são quase sempre incapacitantes.
So, besides, like in the same vein that Senator is describing the project to provide a minimum basic income, I'm also have another bill that is going to regulate the whole profession of caretaker, particularly because many of the rare disease individuals require.
You will have all my support in the Brazilian Senate for your project about the caretakers, the cuidadores.